So, about 20 minutes ago, I finished the physical assessment exam that I've been studying for what feels like forever. And I passed with like a really, really great grade. I even had a minute to review, and I did really good. So, tips for the physical assessment um, simulation exam. One, practice with your partner, especially when you're going to feel for landmark things and like reflexes. That way, you've already identified it once. You can probably identify it again, or at least you're in a good area, because a petite, thin person versus an obese person is two like totally different situations. So definitely practice those things where you really have to do some palpation and location of items. Also, before now, you should have studied a whole lot. What worked for me is verbalizing everything. So I just shrunk the criteria down, put it on note cards by system, and I didn't verbalize it word for word, but I verbalized it with just a word or two, like minimum that I could, like confrontation, crayon or two, and so on and so forth. I'm not writing more or saying more than I need to, just like the topic, so I can remember it. So that's what worked for me, because at my school, you need to verbalize a lot, because normally you're not going to, but they need to know what you're doing, because they're an instructor and they're testing you. So you can't just start putting your stethoscope in your hands on the body. And it's helpful, I think, too, for the patient, because then they know exactly what you're doing. So verbalize, practice on your partner, especially the hands-on things. Practice the equipment. So if you can get into the room like the day before to practice, turn on the otoscope and the ophthalmoscope, just so you know, because it's not a handheld battery, it's plugged in, and it was a lot easier than the handheld battery kind for me. And then I've never even used one until yesterday. And again, maybe you can't see everything. Maybe you can't see all the optic disc in cone of light, or maybe you're having a little bit of trouble palpating the PMI. Verbalize it, okay? Just verbalize it. As long as you're in the right spot, ideally, and you verbalize it, they're not like checking behind you as far as palpation goes. They are very nice. We all make it feel like it's way more stressful than it needs to be. However, you also need to fully prepare, because if you don't know what you're doing, it's really going to be apparent and you're probably not going to do well. So tips: know it all, verbalize it, practice verbalizing all, practice on your partner, and do what works for you. What works for me, or the way I say it, or how I do it, maybe just slightly different. Generally the same, but slightly different than how you do it. Don't come here and try to learn someone else's way, because it's pretty much too late. If you're already here and you don't really know, you might fine tune a couple things like placement and palpation of certain things, but it's really too late to learn it. So do what works for you. And that's pretty much my tips for physical assessment. And always remember, you can do it, okay? You can do it.